Hi everyone, I'm Maria Toste and today I will be performing the procedure on perineal care. First, we need to check the client's chart to verify the doctor's order. This is to ensure that we are going to perform the procedure to the right client. And then after that, introduce yourself and identify the client's identity and also establish rapport. Good morning, ma'am. I'm Maria Toste and I will be your student nurse for today. May I know your name, ma'am?
My name is Manu.
Okay, thank you, ma'am. This is to elicit cooperation and also explaining the procedure reduces apprehension. Now, let's wash our hands to deter the spread of any microorganism. Now, let's explain the procedure to the client and screen client. Ma'am, today, ma'am, we'll be performing the perineal care. I will be cleansing your genital area. Is it okay, ma'am?
Yes.
Later on, ma'am, I will be touching your legs. Is it okay, ma'am?
Yes.
This is to remove the fear and anxiety of the client and to provide privacy and assurance to the client. Now, let's gather all the materials that is needed on the procedure and place it on the bedside table of the client. This is to save time and energy and to avoid unnecessary trips to the storage area. Now, let's position the client into dorsal recumbent position or lying on her back with legs separated, knees flexed, and the sole of the feet rest flat on the bed. Now, let's drape the client, exposing only the area that is need to be cleansed so that we can provide privacy and gain cooperation for the client. Now, let's put on clean pair of gloves so that we can avoid exposure to blood and any body fluids. Now, let's serve the bedpan, assuming that this is a bedpan, so that we can catch water and secretions drained from flushing the perineum. Now, let's wet the area using a warm sterile water. Now, using the working forceps, get the cotton balls with the soapsuds solution and clean from the center of the symphysis pubis downward to the anus. Get another cotton ball, clean starting from the mons veneris in figure of 7 motion by way of labia minora down to the anus. And then discard the used cotton balls earlier. And do it on the other side. Now, let's clean the groin and the inner thighs and do it on the every other side. Now, let's flush it thoroughly with the sterile water. And then, wash it with a dry cotton balls or the gauze pad. Now, let's remove the bedpan and turn the patient in sideline position to clean buttocks if necessary. And then put perineal pads. After cleansing, we need to reposition the client and do aftercare and remove the used gloves. And then, wash our hands. And then, check for the clients if she feels comfortable. Now, let's document the following. Date and time the procedure started and finished and the reaction of the client during and after the procedure. And also, any unusual findings such as redness, skin breakdown, discharges or drainage, and any localized areas of tenderness.